question is, I'm sure you are aware of this, and you mentioned about this the disparity in insulin resistance in South Asians compared to Caucasians. And if I remember correctly, there was a paper maybe a decade ago. Few of the South Asians were co-authors in that paper, like Manisha Chandalia, a good friend, and Sridevi Devaraj, and Iswarlal Jialal, and along with, of course, the guru of cardiology, Scottam Grundy. But what they found was insulin resistance and inflammation. Especially they looked at high sensitivity C-reactive protein, and what they found was the difference in adiposity in Asians, whether it is visceral or subcutaneous. That doesn't completely explain the difference in insulin resistance and inflammation. So, do you think muscle plays a bigger role than fat, especially in South Asians? That's my first question. The second.
Hold on. Sorry, can you repeat your first question? Do you think?
Do you think muscle plays a bigger role than fat in South Asians? Because we South Asians, our body composition is different from Caucasians. Muscle mass is, typically low, and there is evidence to show that there is sarcopenia early in people from South Asia. So, shall I go to the second question, or?
I can probably answer the first one, and then we can go to the second one. That's actually a very good observation, and I know about the study that you're referring to. That's very true. Again, a lot of things are unknown about South Asians, and now, with all these randomized studies that will hopefully have more information. As far as whether muscle mass, sarcopenia, yes, but the opposite is also true. I know, like when, recently few cinema stars, they died. There was this whole thing going on social media, tweets and everything. Oh, don't go to the gym. All that muscle that you build up, that causes heart attacks. So there's just so much out there. And unless you have a significant hypertrophy, like very thick heart muscle that's obstructing the flow, having low muscle, I don't know if that is surely, a culprit. Does a low muscle mass means that you have high fat content? Maybe if that's related. But I'm not aware about the relationship between muscle mass and, heart problems. That's something that's definitely a really good observation, and I should probably, I'll look it up, but there's nothing that I'm aware of it at the top of my head.
Thank you. And the second question is relatively new. My question is the history of COVID-19 a risk factor for cardiovascular disease? I know that it's too soon for guidelines to come out, but what's the current practice? Do you look at that? Or if someone comes to your clinic with a history of COVID, how do you look at them compared to other people? Having said that, I know that most of the people in the US already have COVID.
That's again a very good question. Actually, I did COVID-19 and heart disease as a part of one of my fellowship talks, and there's a lot out there, but the studies that actually, like true, people dying and those having autopsies, there's no correlation of them having any heart disease yet. They there were like, I think 5 people in China, oh, they had a heart attack and all from COVID-19. And then they looked it up and there was nothing that they found to suggest that they have inflammation in their heart from COVID. There was no myocarditis or anything that they found. And the other thing, COVID and even the vaccines, now it's bringing up a lot of other autoimmune conditions. Now, all these autoimmune in which your body, basically just for everyone else, autoimmune diseases are those in which your body, normally our body knows what are bad cells, what are good cells, and here your body just tries to eat up your own cells. And depending on what organ, you could have, any sort of symptoms. So COVID with a lot of autoimmune conditions have been kind of starting to come up. How that is directly going to affect the heart, we don't have that much information, but does that cause premature atherosclerosis, meaning like premature blockages, premature heart attacks? So far, it hasn't come up, but would it be something that would be worthwhile and, worth seeing in future? Absolutely. I think 5 to 10 years down the line, when we have more and more, information, things will come up. But right now, I haven't seen, people have this long COVID syndrome in which they're deconditioned and short of breath. But per se, like when, do a heart cath, or do these guys have heart attacks at an early age? There's not much out there for that. There are people who are already at risk based on their risk factors and everything, and COVID just being an additional stress to your heart. There's something called stress-induced heart attack, meaning like you are a good setup with, hypertension, diabetes, whatever other things, and then you have COVID-19 and it's just too much for your body to take, too much for your heart to fight. In that, yes, you have a cardiac arrest. Is it from COVID? I'm not sure. If it was perfectly healthy, fine, 20-year-old dying with a heart attack, then that would be yes, from COVID. So maybe it exaggerates things, but does it truly cause heart events? Nothing has come out to suggest that yet.
Thank you. The reason I asked that question was because COVID, it's basically an inflammatory storm.
Yeah.
And it elevates the inflammatory state.
Right.
And heart disease, as you will agree, it's an inflammatory disease. So I agree with you. We don't have enough studies, but there are a lot of studies coming out showing that the inflammatory state is not coming back to normalcy or whatever is supposed to be. So that may accelerate the development of cardiovascular disease and probably heart attack. I don't know. So I think I agree with you. Thanks very much for that great talk. And I'm so happy that a cardiologist giving a talk focusing on lifestyle changes rather than pharmacotherapy. Thank you.
Absolutely, my pleasure.
Dr. Dr. Babu Balagopal, he has extensive experience in research. He does a lot of research studies and he works for Nemours. So he will have, we had a great talk with him at the last seminar that we had last year. Thank you, Avcheda, for all your excellent questions. And thank you, Dr. Shah. And we have a couple of questions more lined up. This is from Reshma. She's a very active player of Manofa. She is asking, after taking cholesterol medication regularly for 3 to 6 months, once the cholesterol is normal, can we stop it eventually? Or can we reduce the frequency of medicine?
So typically how it works, when my patients come in and, their bad cholesterol, just to give you a number, it should be definitely, less than 100, less than 70. And I said the European guidelines less than 50. So if you were like 120, and then after starting the medicine, let's say you are 60, that's like a robust response for me. In that case, I try to just do it every other day and see how you do. Because to be honest, a lot of patients have at the back of our mind, the cholesterol medicine is doing its job. So I can like take that ease and, eat what I can, what I want, because my numbers look good. You have such a mental thing that, oh yeah, my numbers look great. I can eat anything and I'm already on a medicine that's taking care of it. But if you're, like one of those patients, one of the people that we recently spoke who's really vigilant with diet and exercise, and despite that your numbers are really low, I mean, it would be reasonable to just back off, do every other day. I've had patients just do it like Monday, Friday, like 2 days. Some people just do it as they want. And you just monitor. Some people, yes, you stop it, but then you have to be very good with the risk factor control, making sure you check your labs. And if you see the uptrend, you just resume it back. But there's just a variety of ways you can play with this. Does not mean that you have to be on the same dose, same duration for the rest of your life.
Thank you, Dr. Shah. That was a good question. Yes, we can take some break if it is normalized with continued lifestyle modification. Thank you. And next question is from Celine Enajumon. They're asking, does intermittent fasting helps with the fat loss and help with the cardiovascular health?
Fat loss, yes. Cardiovascular health, I'm not very sure, because the common notion is when you're intermittent fasting, you're not eating anything, but in whatever, depending on, how many hours you're doing, but in the 8-hour eating period, you can eat whatever you want. And some people mix that with keto, and then that all is not good. But if you are doing intermittent fasting with a low carb meal, yes, definitely it's going to reduce your fat and it's going to help you with the heart problems, not on its own. So yes, if you're intermittent fasting and still eating normally, still eating, like the good amounts of chapati rice, all the good carbs and everything, then it's probably might reduce a little bit of your fat, but it's not going to help much.
Awesome. Thank you. Next question is from Nisha to Dr. Shah. With the pandemic, we are seeing more respiratory issues, and how does this affect the heart and how to prevent those?
How to prevent those? Not sure. Yeah, I just had a good discussion with Dr. Babu Balagopal about the pandemic and heart disease. Definitely, as we spoke, there's a lot of inflammation, there's a lot of stress. If you have the risk factors, things can be triggered. Has it caused people to die from a heart attacks or anything like that? We don't have enough information yet. Nothing suggests as of now, but then these are studies that would take like 5 to 10 years. And I'm not aware of any recent study. How to prevent that? Again, the same risk factor modification that we kept on emphasizing. Make sure you're not a pre-diabetic. Your A1C levels are way closer to 5 than be, north of 6. Make sure that your BMI cutoff is much, much lower, in the sense, even if you are 23, you could be a little obese, which of course your primary care wouldn't say that, but that's a South Asian. Make sure your bad cholesterol is less than 70, your triglycerides are lower, you're following a good diet, you're walking for 30 minutes every day. These are all the preventive measures. Doesn't matter if it's COVID-19 or if it's influenza or any other virus you would have, but these are, the things that you can do to prevent any sort of cardiovascular event. And of course, if things are not under your control, you're doing all that. And if your doctor prescribes you